Hey everyone, welcome back to the channel. If you're new here, I'm Desmond, and today we're talking about alkalosis, specifically metabolic alkalosis versus respiratory alkalosis. These are conditions where your blood becomes too alkaline or too basic, but they happen for different reasons. So, how can you tell them apart? Let's break it down in a way that's easy to understand. Let's start with metabolic alkalosis. This happens when your body loses too much acid or gains too much base, causing the blood to become too alkaline or too basic. Some common causes include excessive vomiting, diuretic use, which can lead to loss of potassium and chloride, or overuse of antacids. Now, respiratory alkalosis happens when you breathe too quickly or too deeply, causing you to exhale too much carbon dioxide, CO2. CO2 is an acid, and when it's lost too rapidly, your blood becomes more alkaline. Some common causes include hyperventilation from anxiety or panic attacks, fever, or even high altitudes. Let's compare metabolic alkalosis with respiratory alkalosis. Here are the key differences between the two. Metabolic alkalosis. Cause: loss of acid or gain of base, e.g., excessive vomiting, overuse of antacids, diuretic use. Buildup: too much bicarbonate or loss of hydrogen ions, acid. Breathing compensation: slow breathing, hypoventilation to retain CO2. pH level: blood pH rises above 7.45. CO2 levels: normal or higher CO2 levels, compensatory mechanism. Respiratory alkalosis. Cause: hyperventilation, e.g., anxiety, pain, fever, high altitude. Buildup: too much CO2 loss. Breathing compensation: rapid deep breathing, hyperventilation. pH level: blood pH rises above 7.45. CO2 levels: low CO2 due to rapid exhalation. Both conditions cause your blood to become too alkaline, but the symptoms can differ slightly based on the underlying cause. Let's go over what symptoms you might notice for each one. Metabolic alkalosis. Muscle twitching or cramping due to low potassium. Tingling or numbness in the hands, feet, or face. Weakness or fatigue. Confusion or irritability. Slow, shallow breathing as the body tries to compensate by retaining CO2. Respiratory alkalosis. Dizziness or lightheadedness from low CO2. Tingling or numbness in the hands, feet, or face due to changes in calcium levels. Chest tightness or palpitations. Rapid breathing and hyperventilation can cause these sensations. Muscle spasms or cramps. Hyperventilation, rapid breathing that may be noticeable. As you can see, both conditions cause tingling and numbness, especially in the extremities. But respiratory alkalosis often presents with symptoms related to hyperventilation, like dizziness and chest tightness, while metabolic alkalosis may have symptoms like weakness and slow breathing as the body tries to compensate. So, how do you identify these conditions? Here's how we can break it down. Metabolic alkalosis. Look for excessive vomiting or diuretic use or antacid overuse. These are common causes of metabolic alkalosis. Breathing. You may notice slow, shallow breathing as the body tries to retain CO2 to balance the pH. Blood tests. Bicarbonate levels will be elevated and CO2 may be higher as the body tries to compensate. Respiratory alkalosis. Look for hyperventilation due to anxiety, pain, fever, or high altitude. Breathing. You'll notice rapid deep breathing, hyperventilation. Blood tests. CO2 levels will be low because too much CO2 is being exhaled. To identify whether someone is experiencing metabolic or respiratory alkalosis, blood gas tests will show changes in bicarbonate and CO2 levels. In metabolic alkalosis, bicarbonate is high and CO2 is normal or higher, while in respiratory alkalosis, CO2 will be low and bicarbonate will be normal or slightly low. Let's make this interactive. Have you or someone you know experienced metabolic or respiratory alkalosis? What symptoms did you see and how was it treated? Drop your thoughts or questions in the comments below. I'd love to hear your experiences. Now let's talk about how these two conditions are treated. Here's the main difference in treatment. Metabolic alkalosis. Treat the underlying cause. Correct the loss of acid, e.g., stopping diuretics, addressing vomiting. Hydration and electrolyte correction. Restore potassium and chloride levels. Acidifying agents. In some cases, medications like ammonium chloride may be used to restore the pH balance. Respiratory alkalosis. Breathing regulation. If anxiety is the cause, relaxation techniques and breathing exercises, like slow, deep breathing, may be used. Oxygen therapy. If caused by high altitude or other issues, giving oxygen can help normalize breathing and CO2 levels. Sedation. In extreme cases, sedation may be needed to slow down hyperventilation. Treatment for metabolic alkalosis is often about correcting fluid and electrolyte imbalances, while respiratory alkalosis is usually about slowing down the breathing and addressing the underlying cause, like anxiety or fever. Here are the key takeaways from today's video. Metabolic alkalosis occurs when your body gains too much base or loses too much acid, often due to vomiting, diuretics, or antacid use. Respiratory alkalosis occurs when you lose too much CO2 due to hyperventilation from anxiety, pain, or fever. Symptoms can include tingling, dizziness, and muscle cramps, but the causes and breathing patterns are different. Treatment focuses on addressing the underlying cause and correcting any fluid and electrolyte imbalances. Thanks so much for watching. I hope this video helped you understand the differences between metabolic and respiratory alkalosis and how to identify and treat them. If you found this video helpful, don't forget to like, subscribe, and hit that bell icon so you never miss a new video. And as always, feel free to drop any questions or comments below. Stay healthy, and I'll see you next time.